Boston's Vigilant Free Speech. I don't remember exactly what the topic was. Topic speech. In my audience, we have my mom, my boyfriend and his mom, Miss Teresa, and her husband Joe.
Hi there.
Alright. Good evening and thank you all for coming. What do we know about schizophrenia? Well, we know that it affects 0.32% of the world's population, as well as it alters the patient's brain chemistry and the personality and their relationships. What we don't know is how schizophrenia comes about. We do know that schizophrenia comes in clusters and is predominantly genetic. According to the National Institute of Health, schizophrenia is characterized by the disruption of thought processes, perceptions, emotional responses, and social interactions. There's a plethora of symptoms related to schizophrenia that all fall under three categories. The first category is positive symptoms. The most common of those is hallucinations and delusions. The second category is negative symptoms, which tend to take away from the personality in a sense, such as lack or loss of motivation and interest. The third category is cognitive thinking. These are the more brainy side of things. For example, lack of concentration or trouble with memory or trouble following conversations or situations. Other notable symptoms are constant numb feeling, which causes patients to be withdrawn, or disordered thinking, which can cause agitation and aggression. Before the diagnosis of schizophrenia, there needs to be multiple tests and scans run to rule out other medical conditions that mimic the same symptoms as schizophrenia. Now, what exactly is schizophrenia, though? Schizophrenia is a personality disorder that affects the prefrontal cortex predominantly, but affects the frontal lobes and temporal lobes. According to a Norwegian study, the MRI regular brain scans of schizophrenic brains show the following characteristics: a smaller hippocampus, smaller cortical volume in the frontal and temporal lobes, as well as a reduction in gray and white matter. Well, all this medical talk, but what does it mean? Let's start with part of the brain that's affected the most. The prefrontal cortex covers the front side of the frontal lobe. And according to the Cleveland Clinic, it handles the ability to process information, social understandings, and executive functions. This means that the prefrontal cortex and the frontal lobe deals with logic, reasoning, decision-making skills, and self-control. It's considered to be the personality of the brain, which therefore means it helps us perceive our social norms. And when it is affected, when either part of the brain is affected, the repercussions are drastic, causing personality disorders such as schizophrenia. Next, let's go even further. Let's talk about the temporal lobe. The temporal lobe is in charge of senses, emotions, language, and memory. Fun fact, the hippocampus is located inside the temporal lobe. These scans show there's a smaller cortical volume and a smaller hippocampus inside both lobes, which can cause the symptoms previously stated. Next is the gray and white matter. You guessed it, these are the part of the brain where it is gray and white tissue. The white matter helps the brain communicate with other parts of the brain, and the gray matter helps with motor skills predominantly, which reduction in any part of the brain can cause the severity of the symptoms to worsen. Next are the types of treatments. There are many different types of treatments, but the main types of treatments are medication and therapy. These are best used together. For medications, predominantly used is antipsychotics. There are many different types of antipsychotics with different chemical makeups that are used to treat schizophrenia. But as I said, medications and therapy are best used together. There are many different types of therapies you can go about, the most common being cognitive behavioral therapy. Cognitive behavioral therapy is based on the symptoms shown. For example, if someone has the symptom of hallucinations, they'll be treated for their hallucinations, whereas someone that has the symptoms of disordered thinking, they'll be treated for the disordered thinking. CBT makes efforts to change thinking and behavioral patterns, as well as making new behaviors and thinking patterns that will help cope with the symptoms of schizophrenia. To conclude, schizophrenia is an intricate mental disorder that affects a small part of the population worldwide, and there's a plethora of research being done. However, there's not much that we can know about it right now. With that being said, the fight for mental health epidemic has been growing continuously over the last decade, and let's hope that it grows even further so we can find out more about schizophrenia. Thank you for coming to my speech. That concludes it.
Good.